Selenium is one of those nutrients where the dose is microscopic, but the marketing gets enormous. The useful version is narrower. Your body needs selenium to build selenoproteins, including enzymes involved in antioxidant defense and thyroid hormone metabolism. That does not mean extra selenium turns a normal thyroid into a faster thyroid, or that it broadly prevents disease in already replete people.
So if someone hears selenium is amazing for your thyroid, what should they ask first? Is the real question whether they are deficient, whether they have a thyroid diagnosis, or whether they are just chasing an optimization claim from a supplement label?
The thyroid link is mechanistic and legitimate. Selenium is incorporated into selenoproteins, and several of those help thyroid hormone handling and cellular redox balance. Think of it as a required part in the enzyme toolkit. But a required part only improves function when that part is limiting, damaged, or clinically relevant. If the toolkit is already stocked, adding more parts may do nothing.
Why does selenium feel harder to estimate than, say, protein? If two people both eat grains, eggs, and vegetables, could their selenium intake still differ just because the soil and food chain are different?
Exactly. Medline Plus lists Brazil nuts as a very good source, and also fish, shellfish, red meat, grains, eggs, chicken liver, garlic, brewer's yeast, wheat germ, and enriched breads. But the hidden variable is concentration. A food can be a gentle contributor or a surprisingly large dose, depending on origin and amount. The antioxidant story is also real, but not automatically clinical. Selenium is part of enzymes like glutathione peroxidases, which help manage reactive oxygen species. In a 2026 secondary analysis in children with ADHD, selenium changes related to antioxidant measures. But the authors also saw signals that higher selenium changes could track with pro-oxidant markers. That is nuance, not a blanket endorsement.
I saw newer studies connecting selenium to glucose, inflammation, and metabolic disease. Should viewers read that as selenium helping blood sugar, or are these still population-specific signals that do not translate into a daily supplement for everyone? Can we draw a hard line around cancer prevention claims? Because older supplement culture still seems to treat selenium like a protective shield, even though large prevention trials did not give people that simple story.
That is the right caution. In metabolic disease, a 2026 meta-analysis found reductions in triglycerides, high-sensitivity CRP, malondialdehyde, and HOMA-beta, with increased total antioxidant capacity. But fasting glucose, insulin, HOMA-IR, cholesterol fractions, body weight, and BMI did not significantly change. So the realistic message is selective marker movement, not metabolic transformation.
What about people on structured weight loss diets or formula diets? Do they need to add selenium on top, or can a balanced medical nutrition program maintain trace elements while weight and HbA1c improve?
The practical safety issue is stacking. Someone may eat Brazil nuts, take a multivitamin, add a thyroid support blend, and then buy a standalone selenium pill. Chronic excess can cause selenosis, hair loss, nail problems or brittleness, nausea, irritability, fatigue, garlic-like breath, rash, gastrointestinal upset, and mild nerve damage. The toxicity signs overlap with beauty marketing targets, which is a nasty irony.
Who is the cleanest candidate for paying attention to selenium, then? Is it someone with low intake risk, absorption problems, long-term forefeeding, a clinician-identified thyroid context, or a medically complex group where labs are actually being followed?
Yes, and the word is monitoring. In children undergoing cancer treatment, a 2026 systematic review found micronutrient abnormalities were common, including selenium, and low selenium was linked in individual studies with poorer survival or more complications. That does not authorize casual supplementation. It supports routine assessment and high-risk medical care. In sepsis, selenium nanoparticles looked promising in a pilot trial, but that is hospital therapy, not a retail wellness product. Form matters, but it should not distract from total dose. Supplements may use selenium yeast, selenomethionine, sodium selenite, or newer research forms like nanoparticles. Different forms can have different absorption and research contexts. Yet the consumer problem is simpler. Do not combine products blindly, and do not treat a specialty form as permission to exceed sensible intake.
If someone and their clinician decide selenium is worth correcting, what counts as a win? Should they expect energy, hair growth, thyroid numbers changing, or is the better standard that a low intake pattern or a lab concern gets resolved without drifting into toxicity?
For thyroid disease, selenium is not a replacement for diagnosis, thyroid labs, medication decisions, or follow-up. If someone has hypothyroidism, hyperthyroidism, thyroid nodules, pregnancy-related thyroid concerns, or symptoms like palpitations, weight change, tremor, or severe fatigue, they need medical evaluation. Selenium can be part of nutrition. It should not become a detour around care.
So the clean takeaway is, respect selenium because thyroid enzymes and antioxidant proteins need it, but do not romanticize it. Food patterns, soil, medical context, and total dose decide whether it is useful or risky. The smarter question is not, how much can I add? It is selenium actually the missing piece here?